Terry, you're on mute. Terry, you're on mute. We can't hear you.
My apologies. Good afternoon, everybody, and thank you again for joining us. If this is your first presentation with me, welcome and thank you for joining us. And if this is not your first one, again, thanks for coming back. Our discussion today is on nutrition for patients with cancer. Now, this is going to be a very general discussion simply because there are different types of cancer, and some of the dietary focus for specific types of cancer are going to be different. And so the information I'm providing you today is an overall discussion about what to eat and when if you are a patient that's been diagnosed with cancer. So let's go ahead and get started. Heather? All right. Some of the things we need to know about nutrition. Of course, people with cancer are going to have different dietary needs. I just kind of, touched on that just a bit. They often need to follow diets that are different from what you think of as healthy. For most people, a healthy diet includes lots of fruits and vegetables, whole grains, breads, cereals, things of that nature. But for individuals with cancer, modest amounts of lean protein and dietary products such as cheeses, milks, things of that nature are usually taken in small amounts, and small amounts of sugar, alcohol, salt, and are saturated in trans fats, much like those we find in butter, meats, dairy, fast foods, and fried foods. When you have cancer, you need to keep up your strength in order to deal with the side effects of the treatments that you are receiving. And so some of the things you're going to hear me say that an individual with cancer should have might not be some of the same things a person that has diabetes or hypertension or other disease processes may want to have on a regular basis. So that's my disclaimer for the day. Next. Heather. So let's talk about the side effects and the problems that people have with cancer and their ability or inability to eat. So, side effects from cancer treatment can lead to a lot of eating problems or eating disorders. Cancer treatments are designed to kill cancer cells, but unfortunately, these treatments can also damage healthy cells throughout the body. Damage to these healthy cells cause side effects that can lead to eating problems. Some of those problems include the loss of appetite, and that's generally one that's pretty common. You have changes in your sense of smell or taste. There can be problems with chronic constipation, diarrhea, and dry mouth. All of these can lead to problems that affect an individual's ability and desire to eat. Next. So there are more side effects. You can develop lactose intolerance. There can be constant nausea from the medications itself. Sore mouths and throats. Some people can develop ulcerations or blisters in their mouths due to the treatments that they're receiving. They may have difficulty swallowing. Some may have vomiting. Some may have excessive weight gain, and some may have excessive weight loss. And it's very difficult to say which of these side effects affect different individuals with different cancer diagnoses. A person with cancer may have a poor appetite or nausea simply because of the stress of going through the cancer and the treatment. But once an individual knows what to expect, then they may feel better about what it is they're taking in. And I wanted to provide you some information that gives us some recipes to address some of these problems so that individuals who actually do have cancer and that are going through this can find things to eat during the different stages of treatment. So again, that focuses on the Google book, Eating Hints Before, During, and After Cancer. Next slide, please. So, preparing to eat well. If you are in the position that you're beginning chemotherapy or radiation therapy or heavy-duty oral drugs to fight cancer, some of the things that you need to be able to do is be prepared for what to eat and how to eat well during this process. So you want to fill the refrigerator, the pantry, or the freezer with healthy foods. Make sure they include items that you can eat even when you feel sick. We want to stock up on foods that need little to no cooking, simply because the individual going through these treatments may be very weak, may not have the support systems to prepare hot cooked meals 3 times a day, 5 to 7 days a week. So we ask them to stock up on foods that require little maintenance or cooking, such as healthy frozen dinners, ready to eat pre-cooked foods. We want to cook foods ahead of time and freeze them in meal-sized portions. Again, an individual going through cancer treatment needs support. So we ask families or friends to help, to shop, to cook during the treatment phase of cancer. Maybe even have a friend or several friends or individuals from your church or community set up a schedule and to help to make sure things are getting done for you, to include meal preps. You want to create a grocery list of items that you usually buy so that it's easier for friends or family to stop and shop for you. And of course, we want to talk with our physicians, our nurse, or dietitian about what to expect. You can find a list of foods and drinks that can help you with these typical eating problems. And those are in that reference I just gave you a few minutes ago. Next. So this is a typical grocery list. This one came from MD Anderson, and I thought you guys might find this interesting because what it does is allows the individual to have a preset list and then check off the things that they would either prefer to eat, can eat, and tolerate, or want to try because of their condition itself. And so if a friend or family member or someone is going to do grocery shopping for you, and you can hand them a list with these types of things checked off, it makes it easier for them and easier for you, because then you're not having to stress over, well, did they buy the wrong things? Did they buy the right brands? Did they buy something I'm allergic to or that I'm not going to eat? Did they go over my budget? All of those things can be very stressful for the individual. And so we want to relieve as much stress as possible so their focus can be on getting well. So I thought you might find this as a very interesting list, and it helps both the individual picking the foods and the individual doing the shopping. Next, please. So, like I said, everyone is different, and there's no way to know what problems a person is going to develop in regards to their eating when they're going through cancer treatment. You may have just a few problems. You may not have any problems at all. But in part, this depends on, one, the type of cancer you have, where the cancer is in the body. Whoops, go back. Okay. What kind of treatment that you're having, how long the treatment lasts, and the dose intensity of treatment that you're receiving. During treatment, it's usually helpful if you are receiving medications that help you to manage some of these eating problems. There can be reflux, nausea, vomiting, diarrhea, all of those, or it could be none of those.
Terry, can you go back? Because we stopped being able to hear you.
Huh. Can you hear me now?
Yes.
Okay, I don't know what happened there. I'm going to just go back and repeat the information I gave you for this entire slide. Because everybody's different, there's no way of knowing what problems are going to develop during the treatment phase. There can be lots of problems, there can be a few problems, or there can be none. But in part, the things that impact what eating problems you develop are based on the type of cancer you have, where the cancer is in your body, what kind of treatment you're receiving. Are you receiving chemotherapy, radiation therapy, oral agents? You know, that plays a role in what effects it has on the body. Not only what kind of treatment you have, how long the treatment lasts, and the dose of the treatment that you're receiving, the intensity. And during treatment, it's important that you have medications that can help to manage some of those side effects and eating problems. Your doctor, nurse, or dietitian can tell you more about the types of issues you might expect based on your specific type of cancer. And it's important that you, if you have problems with eating, it's that you communicate with your doctor, your nurse, or your dietitian right away. Because prolonged eating problems can lead to other issues that impact your healing, your effectiveness of treatment, your tolerance of treatment. Next slide, please. So, what happens after treatment? For most people, many of the eating problems will go away once the treatment is discontinued or ends. Once you finish your treatment, many of your eating problems get better. Some eating problems, such as the weight loss, the change in taste or smell, may last a little longer than the course of treatment itself and may slowly come back. If you had treatment to the head or neck for cancer, or you had some surgery to remove a part of the stomach or the intestines, these eating problems may not go away and may be a new part of your life. That's very important for you to know, because some of these problems are the effects of the treatment. And I'm sure you've heard the term, sometimes the treatment is worse than the disease. And in some cases, the after effects of treatment can be lifelong. Next. So, how do we return to healthy eating after treatment? While healthy eating itself is important, it can't keep cancer from coming back. It can help you regain your strength, rebuild tissues and muscle, improve how you feel after you've ended your treatment. There are some ways to eat well after treatment. 1, prepare simple meals that you like and that are easy to make. Cook 2 to 3 meals at a time. Freeze the extra meals and eat them later. Again, you're still trying to regain your strength. So cooking 3 meals at once may help to save you strength and time later during the day or later during the week when you've got a meal already ready. Stock up on healthy frozen dinners. make cooking easier by buying pre-cut up vegetables and meats, and eat many different kinds of foods. No single food is going to provide you all of the vitamins and nutrients that you need. So we have to develop what is known as a healthy plate. Eating lots of fruits and vegetables, including raw and cooked vegetables, fruits, and fruit juices are very important because they contain the vitamins and the minerals and the fiber that we need for the digestive system. Next. So there are other ways that we can return to healthy eating. Again, eating more wheat bread, oats, brown rice, grains, and cereals. These foods have complex carbs and vitamins and minerals. And complex carbs are broken down slowly in the digestive system, whereas simple carbs are broken down very quickly and can cause significant elevations in the blood sugar. We want to add beans and peas and lentils to your diet and eat them very frequently. We want to go low to no salt, sugar, fats, alcohols, smoked and pickled foods, and processed meats. The reason being, we want to watch our sodium, our sugar, and our alcohol, as well as our fat intake. We want to choose low-fat milk products. And again, we want to eat small portions. I tease and say that, individuals that have gone through cancer treatment should be like cows. And I'm not calling anybody a heifer, don't think that. What I mean is they need to eat about 6 to 7 ounces each day of lean meats and proteins without the skin. So they're eating small, frequent meals. They're limiting their red meats to 3 servings a week. And they're using low-fat cooking methods such as broiling, steaming, grilling, and roasting much more frequently than we are frying foods. And it's best not to drink alcohol at all. But if you do, you need to limit yourself to 1 drink or less per day for women, or no more than 2 drinks per day for men. So what that means is, for women, that would be 1 12-ounce can of beer, or 4 to 6 ounces of wine, or 1 shot of alcohol. For men, it's twice that. Next slide. Okay. Ways to get the most out of the foods that you are able to eat or drink. During treatment, you may have a lot of good days and a lot of bad days. And when it comes to what you're able to eat, it's hard to predict what's going to happen, what's going to be a good day, what's going to be a bad day. So the ways that we manage eating is try, when we can eat, to eat plenty of lean protein and calories when you can. This can help you keep up your strength, rebuild tissue, and help to ward off some of the problems that occur in healing. We want to eat when we have the biggest appetite. You may want to eat a bigger meal when you're feeling your best, and drink liquids and as meal replacements. These can be smoothies. These can be these pre-processed protein drinks or meal replacements. Those we want you to take when the appetite is low. Generally, without an appetite, we still want to take in fluids. And so these liquid meal replacements can help. We want to eat foods that sound good and you're able to eat more of them. even if it's the same thing again and again. And we want you drinking protein shakes for extra nutrition as a supplement to your meals as well. Next slide. So, other ways to get the most from the foods we eat and drink. One, don't worry if you can't eat at all some days. This happens once you've been through cancer treatment. Spend this time finding other ways to feel better and start eating when you can. It's important you let your doctor know if you can't eat for more than 2 days. Try drinking plenty of liquids, even if it's more drinks in a day than what you're used to taking in, or if it's even more importantly than these drinks are taken in on the days you can't eat. Drink a lot of liquids that you enjoy. Drinking these liquids helps the body provide nutrients and hydration. Most adults should drink 8 to 12 cups of liquid per day. And you can sometimes, going through this treatment or post-treatment phase, you'll find it easier to do if you keep a bottle of water near you all the time. And again, try clear liquids, even if that's broth or Jello or popsicles and things of that nature. And you'll see on the right side here, there's some recommendations on some of those clear liquid diets. The things we want you to pay attention to in regards to what you should avoid. Coffee with creamer. A lot of dairy products like ice cream, yogurts, milk. Those can actually, what we call sour on the stomach, or the acids in the stomach will cause the dairy products to curdle, causing nausea, abdominal pain, discomfort. We want you to avoid teas with creamer, just like you would avoid coffee with creamer. And we want you to avoid fruit juices that are high in acid or citric acid, such as orange juice, grapefruit juice, tomato juice, pineapple juice, straight lemon juice, prune juice, and lime juice. These are all juices that can increase the acidity in the digestive system, which can then lead to other digestive problems. Next slide. So, it's going to be very, very important for individuals with cancer or who have gone through cancer treatment to make sure that our food is free of airborne illness, meaning that we're not ingesting bacteria, viruses, funguses, things of that nature, because people going through cancer treatment tend to be more prone to foodborne illness. When this happens, you need to take special care of the way that your food is being handled and prepared. One, it's important that hot foods be kept hot and cold foods be kept cold. Put leftovers in the refrigerator as soon as you have finished eating. You need to scrub all of your raw fruits and vegetables with a brush and water before eating them. You want to scrub fruits and vegetables that have rough surfaces and peels, such as melons, oranges, avocados. You want to clean the outside of those, even though that's not what you're eating. And you want to make sure that you are not eating the peels of those particular fruits and vegetables. Soak frozen fruits and vegetables in water and rinse them if you're not going to cook them and you're using them for like smoothies, or you're eating them raw in parfaits and things of that nature. If cooked, you don't need to worry about washing frozen fruits and vegetables. Most bacteria is killed if it's sub-zero temperatures. Next slide, please. Continuing that, it's very important that you are washing your hands, knives, countertops, cutting utensils, cutting boards after you're preparing your food. This step is very, very important because preparing raw meats, chicken and vegetables, fish, things of that nature can cause contamination with your other fruits, such as your fruits and vegetables. And you want to wash your hands every time you touch raw meat. Use one cutting board for meats and a different one for your fruits and vegetables. That will help eliminate cross-contamination. You want to thaw meats, chicken, turkey, and fish in the refrigerator or defrost them in the microwave. You do not want to leave them sitting out to defrost. You want to cook meat, chicken, turkey, and eggs thoroughly. Eggs should be hard and not runny. Meats should not have any pink in the middle. I know there are people that like things like steak tartare, meat raw, medium. So your meat needs to be well done. Okay. And to be sure that the meat is prepared properly, you should use a meat thermometer and cook at the recommended safe temperatures. If there are questions in regards to cooking at proper temperatures, I've also provided a website here that will give you the appropriate chart that tells you what temperature certain foods should be cooked at to be healthy, especially for an individual who has gone through cancer treatment. Make sure your juices, eggs, and milk products are pasteurized, and eat shell and roasted nuts, not raw nuts. Only eat freshly cooked rice. Rice should not be eaten as a leftover if you've gone through cancer treatment. And that was something I found very curious, and I wanted to know why. For some reason, leftover rice, if not stored at the proper temperatures and reheated effectively at the proper temperatures, tend to cause fermentation. And that fermentation can lead to other digestive problems for the individual that has gone through cancer treatment. Next slide, please. The do nots. These are the things we do not want you to do. We do not want you to eat food processed, eat produce that has not been washed or cleaned, such as berries and grapes. You know how people will go through the grocery store and they'll grab a grape, or they get them home and they first open the bag and they'll try one to taste them. If they haven't been washed, do not eat them. Do not eat raw fish or shellfish, such as sushi and uncooked oysters. Do not eat raw nuts. Do not eat foods, condiments, or drinks that are past their freshness date. Do not buy foods in bulk bins. Do not eat at buffets, salad bars, or self-serve restaurants. Do not eat foods that show signs of mold, including moldy cheeses, such as blue cheese and Roquefort. Do not eat any perishable food that has been sitting at room temperature longer than 2 hours. Don't eat leftovers that have been in the refrigerator for more than 3 days. Don't leave meat, chicken, turkey, or fish sitting out to thaw. I think that's a repeat. I've told you that already. And don't eat leftover rice. That, it is just unsafe. And for more information about infection and cancer treatment, especially chemotherapy, you can access Support for People with Cancer, which is a booklet from the National Cancer Institute. It is a free booklet, and it is found at www.cancer.gov/publications patients-education/chemo and you. Again, these slides will be made available to you so you will have access to each of these websites. Using foods, vitamins, and other supplements to fight cancer. Some of the questions that have been posed are, how can we fight cancer by eating certain foods and taking certain vitamins and supplements? Well, there's no studies to prove that there's any special diet, food, vitamin, mineral, or dietary supplement, including herbs, or combinations of these that slow the rate of cancer, cure cancer, or keep it from coming back. In fact, some of these products can cause other problems by changing how your cancer treatment works. So you need to be communicating regularly and fully with your healthcare team. That's your doctors, your nurses, your dietitians, about any vitamins, minerals, or dietary supplements or herbs that you're already taking or are planning to take. Also, talk with them about going on special diets. That's very important. We have people that will try cabbage diets, they'll do Mediterranean diets, they'll do keto diets, and it is very, very important that you are communicating with your healthcare provider, because these diets can affect how your cancer treatment works, what side effects you may have, and if these diets actually block your treatment altogether. And again, for more information about that, we have other resources. It's called Thinking About Complementary and Alternative Medicine, a guide for people with cancer. Yet another booklet that we have available to assist you in deciding what vitamins, minerals, and substances you should or shouldn't be taking. Next slide. So, eating changes to help to improve your nutrition or your nourishment. Unfortunately, for a lot of people that have gone through cancer treatment, they need to make changes in the way they eat. One, they need to eat smaller, more frequent meals to help them stay nourished throughout the day, especially if you're experiencing that loss of appetite or that frequent nausea. You want to eat high-calorie, protein-packed foods like lean meats, milk products, eggs, and beans, but remember how they should be prepared. You want to eat a variety of colorful fruits and vegetables, which naturally contain substances to promote better health. Some of those are antioxidants. And again, a resource for you, eating habits before, during, and after cancer. Next. So again, we're providing you more resources to help you and guide you through this process as we are trying to navigate healthy eating through cancer treatment. And of course, the cancer support community dedicated to providing support. That's, of course, the website that we have here, Cancer Care Incorporated, and the American Cancer Society. All of these organizations have supplemental information that can provide you specific dietary needs for specific types of cancer. So remember, my presentation today then is an overview of what patients with cancer can have before, during, and after treatment. But the specifics on what to eat with what cancer is going to be through these resources. Next slide. So that would conclude our discussion portion of the presentation. So what I'll do at this point is I will address your questions.
If you
Do
have
we
any
have any?
questions, you can take yourself off the mute and ask the question, or you can post it in the chat.
Nobody has questions today?
None at this time. Maybe
Okay,
they'll have some questions after you do your cooking demo.
Okay. Today's cooking demo is being done in a different setting. Because I needed the stove today, I'm actually doing the cooking demo from my home. And so I'll need you to give me just a few minutes to set up to prepare for our demonstration. Okay, Heather, you. Okay, can you guys see me?
Yes.
Yes.
Okay. Our demonstration today is going to be on a food that would be healthy for an individual going through cancer treatments. Today, I'm going to make lettuce wrap. And I'm going to talk about the ingredients. So I'm going to pull the things that needed to remain in the refrigerator out of the refrigerator. And you'll have to trust me to know that I'm telling you these veggies that I am using have been washed, but today, because we only have a short amount of time, I'm not going to use the fresh bell peppers, but I'm going to use a bag of frozen peppers and onions. And I'm going to show that to you now, but they've been in the freezer the whole time. Again, we don't want to leave foods out when we're dealing with patients who've had cancer. I buy these quite often and I use them, and I mainly use them making Asian food. So we're going to use about 2 cups of the pepper stir fry. And what it's got in it is red peppers, yellow peppers, green bell peppers, and it's got onion in it. So that's going to save me a few chopping minutes. We're also going to use, you have to excuse me for a second, frozen peas and carrots. And our protein sources I've already prepared for us. And that's going to be chicken. And I've already diced up our skinless chicken breast. And we're going to use a wok. And we're going to combine our 2 cups of chicken breast, 2 cups of our peppers and onions. We're going to add some additional plant-based protein. I'm using jarred mushrooms in water. I'm adding minced garlic. We are using natural honey. We are using low sodium soy sauce. And it also calls for fresh ginger. But because I don't have the time to grate the fresh ginger right now, I'm going to cheat. And we're going to use powdered ginger to flavor our lettuce wraps. And then, of course, once we prepare our ingredients, it would be placed in our lettuce leaves. And so I'm going to go ahead and start this so that you can see what I've made. Okay. So the first thing we're going to need is about 1/4 cup of olive oil. And we want to make sure that we are using our poly unsaturated or mono unsaturated oils. And the reason that we're using this oil is it's just enough to give us the movement that we need in the wok so that our food doesn't stick. Now I'm going to turn this so that you guys can actually see the stove. Can you see the stove if I do this?
Yes.
Okay, so we're going to add our ingredients once I get my wok hot. I use my mini wok in doing this. This wok has had many, many days of use. And so usually when you are stir frying vegetables, you would use medium to low high heat. I know that's a low high, but you don't want it to get it so high that you cause a degradement or a breakdown of your olive oil. Olive oil will not tolerate temperatures higher than about 300 to 400 degrees because it causes it to break down. And with a gas stove, this oil heats up very quickly. So the thing I want to do, because my chicken is pre-cooked and already diced, I don't have to cook that. So I'm going to add my vegetables in first, mix them, and then add my chicken. So I'm adding about a cup of the frozen peas and carrots. Now you can actually use fresh peas and carrots if you'd like. I do not recommend canned because canned vegetables have added salts and other chemicals that we don't want to add to our food, especially if we've gone through cancer treatment. So as you can probably see, I have a cup of our frozen peas and carrots. We have our peppers that we're going to add about a cup of. Once we've added that, then of course we're going to add our mushrooms. Now these you want to drain. And I love mushrooms. They are a wonderful source of protein, plant protein. And we want about a cup of those. I wish you guys could smell this. It's wonderful. Now, once we've added those ingredients, then we want to go ahead and add our chicken. And I'm going to use 2 cups of chicken. I've already measured that, so I know exactly what I've got. Now, of course, we still need to add our other ingredients. Like I said, because I don't have the fresh ginger, I'm going to add about a teaspoon of my ginger powder. Another thing that people can put in this, there is a spice called 3 spice. It is an Asian spice and it contains 3 different spices in the mix. And it can be used in addition to or in a place of the actual ginger. If at all possible, though, the fresh ginger is best because it adds a robust flavor and it's healthy for us. Now we're going to add about, if I have to check my recipe real quick. It says 2 cloves of minced garlic. And so at this point, that's going to be about I'm assuming about a tablespoon. And so because I like garlic, even if I'm wrong, it's going to taste great. And garlic is wonderful for patients that have had cancer. It's good for the heart. We're going to add just a pinch of kosher salt. This salt can be replaced with Himalayan pink salt, but you only want to add a very, very small amount. That would be like half a teaspoon, because Himalayan pink salt has a more robust salty flavor. And one of the things that's important about this is the low sodium soy sauce. And that's about half a cup. And then we're going to add just a small amount of honey. We want to make sure that if you're using honey for a person with cancer, it needs to be pasteurized. I know you're probably going, what? But yes, honey should be pasteurized, because if it's natural honey, that still contains the bacteria. And so we want to try and keep our food as bacteria-free as possible for those individuals who've had cancer. Okay, and you want to let this cook down for about 5 to 7 minutes, allowing the flavors to blend. And then once it does, this is served in a lettuce leaf as its cup. And so this would provide all of the natural vitamins and minerals that an individual that has had cancer would need. Not only for someone with cancer, for someone that may have diabetes, high blood pressure, or most chronic diseases. What we have just prepared would be healthy for any of them. And I'm going to show you what this looks like as we serve it. I wish I could invite you guys over for lunch, because we've got this now and y'all are not here. Okay. Can you guys see this? Heather, can you guys see that?
Yeah.
This would be a lunch. And more than likely, the serving portion would be 3 of these. That would be it. Does anybody have any other questions?
No.
No?
No, it doesn't look like it. They're all saying yum. They want to come over and have lunch.
You know what? They're welcome to. I'll give you my address, okay? Guys, thank you so much for your time and your attention. We will make this recipe available to you. I will be sending that to Heather today, and she will include it with the, I'll actually put it on the slides so that you have the recipe when you receive the slides, okay? Well, everybody have a great rest of your day, a great rest of your week, and bon appetit.
Thank you. You
Thank
guys,
you.